Imagine spending your money on something, only to find out your neighbors are spending their money on the same thing for half as much and twice the quality. I'm willing to bet that would probably piss you off, right? That's basically the U.S. healthcare system in a nutshell. Let's talk about it. The U.S. spent twice the average of healthcare costs per capita and yet still managed to have worse health outcomes. Health outcomes are just the impact of a healthcare service, right? So that encompasses things like quality of life, mortality, life expectancy, effectiveness and timeliness of care, etc. So why? If we're spending all this money on healthcare per person, shouldn't we have at least better health outcomes? One would think, but there are a lot of factors as to why we don't. And some of those reasons include high out-of-pocket costs, which create financial barriers for many, administrative inefficiencies, and I think the biggest one here is prioritizing treating illnesses over preventing them. Yeah. Comparable industrialized countries like Japan, Netherlands, Australia, and Germany have much higher health outcomes due to a variety of factors, including universal health care, highly accessible quality medical care, and a much stronger emphasis on preventive measures. Universal health care, in short, is just ensuring equal access to quality health care without financial harm, right? And there are three main ways that countries tend to go about this. First up is the single payer method. So the single payer method, essentially you just have one entity. That entity usually is the government, in which all the healthcare providers in that country bill their services to. All citizens receive high quality comprehensive care with the freedom to choose their providers. And then we have the national health insurance. And again, the government is the single payer entity for this model as well. So with this, funds are raised through a national plan that all citizens pay into. It's a not-for-profit model. There's no claim denied, and it typically does a pretty good job of cutting down on unnecessary administrative costs and things like that, right? And then we have mandatory health insurance, which basically just mandates that all residents of that country have to have a health insurance plan or they'll be fined. And so some possible cons might include reduced innovation. And so because there is less competition in a universal healthcare model, some private insurers may feel that there isn't enough incentive to be innovative and to create new services and things like that. And then, of course, because everyone is insured, it might result in longer wait times. Believe it or not, the U.S. healthcare system already encompasses some components of universal healthcare, such as Medicare, which is a national health insurance program for individuals 65 and up, as well as individuals with certain disabilities. And for those who are 65 plus, they are automatically enrolled into Medicare Part B. There's Medicaid, which is a cost-effective health insurance plan for those with limited income. And then, of course, the passing and implementation of the Affordable Care Act, which expanded Medicaid, making health services even more accessible to those from a lower socioeconomic background, and also mandated that preventative services like immunizations, checkups, screenings, all be covered under your existing insurance plan at no additional cost. In a proposal created by Laurent Inaud and Amy Finkelstein, they offer a solution that takes into consideration some of the key issues that exist within the current U.S. healthcare system. Their solution, in short, would provide free, basic, universal coverage to all Americans with the option for people to customize and or add additional coverage to their plans if they deem it necessary.